Good morning. This is Patrick Cummings with NISAC. Would like to thank you all for joining us again on our continuing series of webinar trainings. Before we get into introducing the topic and introducing our speakers, just a couple housekeeping notes. Please type in any questions that you have within this webinar to us. We will take all the questions that you have, and at the end we'll provide some time for some Q&A, for some answers with our guest speakers. And if any questions that we don't get to, we will make sure to email you back and get those to you. Also, this webinar is being recorded. We will have this on the NISAC website so that you can share this with all your county members shortly. And then also, before I get into the topic and the speakers, NISAC would like to thank our sponsor, Good Energy, for supporting this webinar. Good Energy is a New York-based energy consultant and aggregator that helps municipalities and businesses cut costs by providing budget stability and a plan to save money through community solar and cooperative buying strategies. During these economic times, it is especially important to have cost-cutting measures in place. Learn about savings through Good Energy by emailing county@goodenergy.com or by calling 518-514-2798. Again, thanks for joining us. This is Patrick Cummings. I'm counsel with NISAC. This webinar is near to my heart. It highlights the importance of public service and informing us as employers how we can ensure a safe work environment. The COVID-19 crisis brought the best out of New York County employees. The dedication to serving the public arguably has never shone brighter, as county frontline employees risk their well-being to save others. County employees in our health departments, hospitals, nursing homes, as well as our first responders, spent tireless hours serving the public, and the results turned New York from being the world's largest COVID hotspot into today having some of the lowest, safest numbers in the world. At the same time, non-essential employees, a misnomer if there ever was one, work behind the scenes from their homes, supporting the frontline employees and continuing to provide the public with other needed health and safety services, such as DSS functions and mental health programs. Now that the COVID crisis has become more manageable in New York, many employees, including counties, are returning those who have worked from home back to the office. Counties have also opened their doors to the public for services. As counties look to reopen more of their offices to employees and citizens, new policies have been put in place to help a safe reopening. Much of how counties operate in this new world is left to local governments to determine. This webinar will address how counties are establishing and defining new ways of planning, managing employee workforce readiness. This session will also include new technology solutions that can help counties monitor work readiness, employee health, and coordinate facilities accordingly. With that, I would like to introduce the first of our two expert speakers on this topic. The first is David Argue. He's the Senior Manager at Accenture Technologies. David and his team use leading technologies and ecosystem partners and startups and the largest delivery network in the world to provide a powerful range of capabilities that can be tailored to your most complex business and government needs. With over 100 innovation hubs deployed around the world, they help clients continuously innovate at speed and scale. David, if you could take it from here, we appreciate you joining us.
Thank you, Pat. Good morning, everyone. Dave Argue here. Thank you for the opportunity to speak here. This is definitely a subject that's equally near and dear to my heart. Having spent a lot of time with our clients, both in the private as well as public sector, this is certainly a unique and challenging time for all of us. If we could go to the next slide. One of the areas that we wanted to talk with you or share with you is some of the lessons that we're learning as we begin to work with our clients to figure out how do we safely reopen and return to our offices and workplaces I think it goes without saying that COVID-19 has definitely upended the typical work patterns and paradigms that we were used to, and has certainly presented a myriad of challenges, especially as we start to think about how do we return to sort of our normal operating parameters. And I think one of the things that has definitely been top of mind for our clients and how we've been thinking about the approach here is, there is without a doubt a level of needing to sort of reimagine or reinvent ourselves in terms of how we operate, how we work. Even thinking about the physical spaces that we have in our offices or in our workspaces to ensure that as we reopen and as we return to providing the services to our citizens, ensuring that both our employees as well as our sort of end customers or end consumers of those services have the confidence that we're providing a safe space, safe environment, and really able to, facilitate the needed services in a safe and practical manner. One of the things that we're certainly seeing, and this goes, this is true whether it's a boardroom or a county office, right? There has been a dramatic and rapid shift into working remotely, and with that, one of the sort of themes that we'll touch upon here is, having that adaptability or that flexibility as we reopen to, address or evolve with the changing and dynamic situations. Nobody knows what's going to happen 6 months from now or a year from now, but certainly, we can, plan for the worst and, implement those plans, with a thoughtfulness and with purpose. And do everything that we can to ensure that we're able to safely open and resume services without putting people unnecessarily at risk. But I think one of the things you'll hear from myself as well as our next speaker, Mike and Nancy, is this notion of having a degree of elasticity or flexibility as we begin to reopen. Certainly nobody wants to run into a situation where we are having to reclose, economies or offices, but certainly time will tell as we march forward into the next evolution of or next chapter of the COVID-19 pandemic. So I want to jump into maybe the next slide and talk a little bit about what we're seeing. If we could go to the next slide, in terms of some of the key patterns or key elements that are popping up in terms of the discussions that we're having with state and local clients, as well as the private sector. I think one of the things that we're certainly engaging in conversation and strategy and design with our clients is, obviously there are key practical elements that can be implemented, and I think goes without saying everyone is largely familiar with social distancing at this point. And certainly I think we are all becoming used to the GoToMeeting or the Zoom or the the remote modes of working. But as we start to get back into the workplace, some of those things still are going to be with us, right? Like we're still going to be social distancing if we're meeting in the office, and what does that mean in terms of our meeting spaces and the physical layout of our offices. We're still going to need to be thinking about regularly washing our hands, and this is an area where it seems like a small point, but not everyone thinks about, like, do we have enough hand sanitizer in the office and at regular locations and in regular intervals, or even thinking about if you can imagine sort of a an office space and rows of desks or whatever, is there a cube or an office space at the end of a walkway or a hallway that everyone has to pass by, and thinking about do we fill that corner desk or that corner cube, or maybe do we leave that space vacant with the notion that we want to minimize people's exposure. So a lot of the topics are this gradual resuming of our previous operations, but doing so with some adjustments, and certainly looking to bring the strategy into place about how we handle our people, our physical places, and then also the tools and other devices that we can use to help ensure that the right policies and procedures are being implemented effectively to help support that overarching approach and strategy of ensuring that we're able to bring people back into the office and able to effectively service the community at large, whether that's a child case manager going into a home, or providing services for our senior citizens or our youth programs. Let's jump into the next slide, because I think the next slide is going to be one that is pretty near and dear to my heart. One of the things that I think often gets overlooked is sort of the people aspect. And I think certainly one of the topic areas that we've been coaching a lot of our leaders on is the notion of these are very troubling and stressful times. It goes without saying that there's a need for a human element here, and by that I mean being empathetic and helping to guide our employees, our coworkers, and the citizens and stakeholders that we're providing services for. And to do that, we have been really trying to focus on the empathy and understanding that these are difficult times. If anyone has been working from home and has children, how challenging that can be to juggle the kids while you're trying to perform your duties. And I think there is a level of understanding and a level of compassion and communication that needs to go into re-engaging with our workforce. And to that effect, we've been sort of phrasing it as sort of the elastic workforce. The notion that we need to have a little bit of flexibility and understanding as we get through these times and get back to a more normal sort of setting. And so as leaders in your community, as leaders in your particular space, whether that's public health or supporting local industries or providing programs for youth or elderly, how do you effectively communicate the resiliency, communicate the compassion? How do you approach understanding that we may need to be adapting how we deliver our services, how we facilitate our work shifts, how do we approach this what hopefully will be temporary situation and get through it together and return to a more normal environment and a more normal operating mode on the other side. And so to that extent, if we jump to the next slide, I think certainly one of the elements that we've been engaged in conversations is how do we facilitate working remotely? How do we facilitate bringing a mix of some employees that will be in office and some that might be remote, and how do we bring the blend of the right collaboration tools, the right communication abilities. If you think about the different services that you provide, one of the areas that we've certainly been discussing and strategizing with is, can you redesign some of your processes? Can you redesign some of your engagement channels such that for the more vulnerable, for example, your senior citizens, are there ways to deliver communications or services without necessarily having to be in person? Certainly not all services provided by a county can be facilitated remotely. If you think about, again, the child service worker, there's a need to go into the office, right, or go into the home But maybe perhaps there is an interim solution where to facilitate the protection and well-being of the household as well as the caseworker. Could you facilitate some of those via a remote conference, or could you send materials through a digital channel or a mail system in advance to reduce the amount of time that you need to be in the home, and adapting in the interim to accommodate some new ways of working, at least until we get to a point where we're on the other side and can safely resume back to sort of our normal operating paradigms. If we go to the next slide, I think I mentioned a little bit about this. We've been working with some of the government agencies, for example, around reimagining the workplace. So I cited the example of an office desk that sits at the corner of a heavy traffic flow, right? And thinking about whether we stagger every other desk, for example, or whether we think about the ability to bring in hand sanitizers, or how frequently are we cleaning offices, and looking at the variety of different ways that we can mitigate choke points, for example, or think about how do we redesign office space, or do we bring our employees back maybe in shifts, or staggered occupancy, and for those that could continue to work remotely, are we able to facilitate that same culture and that same collaboration that we had in the office and face to face, but maybe there's a subset that are continuing to work remotely, and continuing to enable that effective reduced in-office capacity, at least as we come back online and as we bring to bear the new policies and procedures, and how we effectively implement those and iterate and evolve those as we continue to work through and learn what works, and certainly see how the pandemic unfolds in the coming days, and hopefully marching towards a vaccine or a cure to help us get further along on that process. So certainly, thinking through not only just the human elements, and the augmenting our workforce remotely, but also like how are we physically enabling things like social distancing, or how are we physically enabling things like hand sanitizer stations and what have you. I think another key component, if we sort of jump to the next slide here, is really around when we think about as a office manager, or as a a leader within my community, or on my council, how do we bring to bear some of these changes? How do we bring to bear new policies and procedures about who's in the office, or how are we augmenting our services to the public to maybe temporarily accommodate more of a digital touch point, and how do we effectively communicate that in a empathetic and human to human sort of connection. And some of these things include facilitating basic policies and procedures, like continuing to ensure that we're socially distancing, or if you don't need to be in the office, maybe continue to work remotely. But also there's the notion of being elastic and being flexible. Certainly if schools are unable to open and we continue to be home with children, there's a bit of an accommodation there that we have to sort of think through, and how do we ensure that we're balancing the right services and capabilities we provide to the public, while thinking about our employees, or our field service workers, or the individuals that have to help effectively deliver those services. And certainly it goes without saying that throughout all of this, effective communication, policies, procedures, etc., to help ensure that everyone's understanding of what's expected as we get into this next chapter will be paramount to ensure that we are, all in this together, and we are effectively delivering on the key outcomes that we need to for our councils, our cities, our most vulnerable stakeholders. To that end, if we go to the next slide, and I won't get too much into the tactical of the particular technologies or processes that can be enabled, but if we think about what are we trying to achieve as we reopen, right? We want to, enable a safe workspace, safe environment, not only for the employees, but for the end public stakeholders and consumers of services, and then provide a sense of trust and well-being, right? To that effect, it's certainly something that's driven by employee awareness or by communication about what services or what new policies are coming online. It's also about how do we effectively adapt or respond if, for example, there is a flare-up in my community, or if there's a university in your community or near your community, and students come back in the fall. To what extent do we see flare-ups, and if there are a flare-up or an outbreak, how do we respond to that without necessarily shutting down all of our services? So how do we temporarily pivot into a more resilient workforce so that we can continue to provide the services that are much needed by our communities without necessarily having to leave them completely stranded? And then, how do we, continue to engage with our employees and with our communities to ensure that, they are of healthy and sound mind and body? And how do we show them that, we are here for them and that we are able to help them? And through this, what tools or processes can we employ to help facilitate these outcomes, such that, we are providing, the much needed reach out to a coworker to check in or ensure that they're well, or enabling the continuity of a service that's provided to the elderly, or to ensure that if we can facilitate permitting or ticketing or what have you, that we do that without necessarily forcing someone to come into an office where they might have apprehension about going into a physical space. And how do we effectively adapt what we do as we enter in this new chapter, such that we are continuing to operate with the safety and well-being of our community and colleagues, and doing so in an effective manner. Before I pivot to sharing turning this over to Mike and Nancy to speak about more of the enablement aspect of that. If there are any questions, happy to address any.
Thanks, David. We'll take Q&A at the end and circle back. And again, for everyone listening, please type those into us, and we'll get those questions to our speakers and some answers to you at the end of this webinar. I'd like to turn this over now to Nancy Marks, the Regional Vice President with Salesforce Public Sector. Nancy and her team are responsible for Salesforce state and local business in the Northeast. For the past 15 years, Nancy has been working with government clients to reimagine their processes and use data-driven efficiencies to deliver more value to their stakeholders. Nancy, once again, thanks for joining us, and we appreciate the education you're about to give us.
All right, well, thank you, Pat, and thank you, NISAC and our sponsor, Good Energy, for the opportunity to speak with you this morning. Just as a reminder, any procurement decisions should be made on currently and generally available products and solutions. That's my safe harbor statement. But let's get to the good stuff. Next slide, please. So as you heard from David, there is a lot to be considered when you think about how are you going to safely and responsibly bring your employees back to the workplace, or even open back up for just general public citizens, businesses that need to visit your county offices. So there's a lot to be considered, things that 6 months ago we probably never even would have imagined that we've been having to deal with. And there are a lot of aspects of this. Certainly you will be thinking about how you conduct business in different ways, and extending capabilities that you didn't even consider in the past. Next slide, please. What I'm going to focus on today, and it's a really great, I think, segue to some of the things that David shared, is how can you actually implement some of these things? So Salesforce, primarily is a cloud-based technology provider. I'm going to focus on some of the capabilities that we have brought to market to assist our company, our private and public sector customers in bringing their employees back to work. I'm going to look at this from two perspectives. The first is going to be that piece about you have individuals that have been working remotely that you will want to, and they will want to come back into the office in some way, shape, or form to conduct their work. How do you do that safely and responsibly? But then you have visitors as well that may be needing to come into offices, and how do you manage that in a way that you never even imagined that you had to? So I'm going to look at it from that perspective, but then I'm also going to talk about, there are probably new and different services that you need to provide that you didn't have to provide 6 months ago, and sharing some thoughts and observations on how you can start to deliver more of these services online or a combination of online and in person. Next slide, please. So in speaking to many of our customers, one of the first things that we felt was paramount is for any county executive is the need to have kind of this single command center to really have at their fingertips all information about their organization's readiness to return to work. So we have developed a command center technology that allows all of this information to be aggregated, so that as a county executive or someone responsible for facilities, HR, that you have kind of a single pane of glass, if you will, to be able to see real-time information on the health and wellness of your employees, the readiness of the facilities. The purpose of this is to really allow you to comply with, let's face it, there are different executive orders and requirements in place around occupancy, doing wellness checks, that you do need a way to be able to kind of execute and implement on those requirements. And so the command center is kind of the first pane of glass, if you will, to be able to access all that information in real time. Next slide. You kind of look at it a little bit more deeply. You may look at this and say, oh, this is like a reporting or an analytics dashboard. It is, but it really is a lot more than that. It really is an actionable application that is rolling up information from a variety of sources that you can get real-time updates and alerts and be able to make decisions. And that's really the key thing. I mean, you could collect a lot of data with spreadsheets and emails and try to make decisions, which might work if you're a very small organization, but if you have thousands of employees and multiple facilities to deal with, it's probably not practical or sustainable. So we have this kind of starting point as the command center to be able to aggregate all that information. And what we're finding from the customers that we're talking to, that really the two main things that counties and state governments are grappling right now is the mechanics of bringing folks back to work. Next slide, please. So the first piece of that is, the reality is you can't just bring everybody back into the office like they were working on March 1st. Just as David described, you're going to need to rethink your office space. You're not going to be able to fill every desk and cube, so you're going to need to think about some kind of shift management or scheduling capability to make sure that you're in compliance with the occupancy. People feel safe about coming back into the office, and you've got the right people working remote and the right people working at the office to meet the needs of the business. So with shift scheduling, we've developed a mechanism to allow you to really define what is it that you need to meet the needs of the county. What skill set, what shifts are you going to do, rotations. You can kind of build out that model, if you will, and design shifts along the needs of what skills and resources need to be available, and then allow your employees to sign up for shifts, and allow kind of one of the things that David talked about is, you know, your employees have, you know, different challenges now. They may not have daycare and childcare and need to maybe have some accommodations around when they work. So you can combine both the needs of the business and the needs of the employee, you know, and have a means to schedule individuals when you need them, and at the right time. So next slide, please. Just to kind of give you a little bit of a visual, you know, really you kind of think of it as, you know, as a calendar on steroids, where you're looking to, you know, kind of have extended shifts, maybe shorter shifts. And one of the neat capabilities of our solution is the ability to optimize, because it's not just kind of plotting this out on a calendar. It's really looking, again, as I said, what you need and what skill sets. You may have other considerations around union rules that you need to accommodate when you schedule as well. So building those kind of all into the solution and then optimizing to meet all of those different constraints. And just kind of a simple example, depending on the size of your offices, if you probably think about in February, you didn't really care if there were 20 people lingering in the lobby waiting for the elevator to go up to the third floor. Well, today that would be a big no-no. So how do you even start to stagger arrivals to make sure that you don't have crowding in the lobbies and around elevators, and giving individuals kind of a window in which they can arrive that meets their kind of commuting constraints if they're taking public transportation. So there's a lot of things that go into planning and making sure that, you know, you've got people arriving at the right time, and you have the individuals coming in to the office and meeting. You know, you may only be at 25 or 50% occupancy, and how you deal with it. So kind of the first kind of, I would say, tactical piece, if you're trying to manage occupancy, is kind of setting out those shift schedules and allowing individuals to be able to sign up for those schedules. Next slide. The next piece of it is, again, in New York State, if you're bringing people back into an office setting, you are supposed to be doing, you know, kind of a daily wellness check, and making sure that if somebody is assigned to come in at a particular date and time, that they in fact are not exhibiting any symptoms and are, you know, well enough to come into the office. So we've talked to a lot of different customers about different ways that they're looking to instantiate this as kind of part of our overall work.com portfolio. We have a employee wellness check capability where you can design which questions you want to ask your employees. And based on the answers to those questions, you will notify them, you know, whether they're permitted to come to work that day or not. And all of these different things I'm speaking to, you know, are being kind of rolled up into the command center. They're all in one place, so that you have not only the ability to see what happens today, but kind of look at history and trends around wellness. So next slide, to just kind of give you an idea of how this might look. So it doesn't have to be a mobile device, but most people prefer, you know, the idea of there is some kind of questionnaire or survey that the employee is answering each day at 6 a.m. or whatever you designate. They answer some questions, and based on the answers to those questions, you determine whether they are permitted to go to work. And then the next slide gives you an illustration of kind of the notion of a boarding pass. This is what, you know, a lot of our customers want to have, this very simple thing that says, you know, Eddie here is cleared. He's answered the wellness questions appropriately. This is his window when he's supposed to be arriving in the office. And you know, if you have an attended lobby, you can kind of show that to the receptionist or the security guard, so that they know that Eddie, in fact, is supposed to come to work. If you have a more sophisticated badging system, you can certainly integrate some of these things with badging to make sure that they're not permitted to come in. But the whole idea is kind of managing that daily process of checking in. And the next slide all of this is constantly updated and rolled into the command center. So at any time, whether this is a supervisor, someone in human resources, or an executive, can see the overall wellness status at any moment in time. So again, this is all real time. The information is being stored in the Salesforce platform in the cloud. It's secure, but you have the ability to look at any point in time what your a particular skill set or a particular location, what their wellness status. And if someone hasn't completed their wellness questionnaire, you can flag that as well and certainly take appropriate action. So the core part of what we're talking to customers about these days is really that very much the process of how do I bring people in and maintain the capacity, social distancing, and wellness requirements, just to ensure that people feel comfortable. If I'm coming back into the office, that the other people around me, are also safe and well to come back to the office. You could also extend some of these capabilities if you're looking at bringing, visitors, citizens, businesses to conduct business at the county. Next slide. Another piece that I do want to mention, and David talked about this early, there's a lot of change management that goes with all of this. This is not something, as the title, this is abnormal, right? So one of the things that we've also offered, is curated content around employee learning and well-being. How do you educate your employees about really what the processes are, and doing that in kind of a fun online learning capability? And depending on the complexity of the roles that they're playing, you can actually make this kind of a bit of a mini certification if that's a requirement of your business. But it's always the people, process, and technology, and you need to look at all aspects. So that's kind of the bringing your employees, and by extension, your citizens, back into the office. Next slide, I'm going to segue a little bit into some of the other things that you're dealing with. I mean, certainly as a public service entity, you are used to responding to emergencies and providing your citizens and businesses with relief in different forms. I think we would all agree that what we're seeing now is orders of magnitude more than what we've ever seen before. And how do the citizens that need assistance, emergency assistance, request it? So a lot of the services that you may have offered to provide this support, I need housing, I have food insecurity, I need childcare, all of the types of things that you deliver in partnership, sometimes with state or your nonprofit entities. How do you make it very easy for your citizens and businesses to request assistance using more digital services? And how do you manage an influx? I think for any of the downstate counties that think about, we're kind of getting into hurricane season. And if you think about having to manage any kind of natural disaster with COVID, like they're grappling with in Florida, and I think we could all agree that they're not doing a great job on a lot of fronts in Florida, but how do you manage, the compounding of what you are dealing with, a pandemic, with any kind of natural disaster? So what we have done at Salesforce is looked at taking a lot of the solutions that we've had in market for years that enable our customers to do emergency response management, and we've tailored them to support some of the needs that we're seeing with COVID-19. As I had outlined, if someone's quarantined and isolated, they may actually need someone to deliver food to them where they never needed that service in the past. And then the other item, next slide please, that we're seeing an influx of is inspections are not new to county government. There are lots of things that you need to inspect, and you likely have solutions to kind of manage the field inspection. But we have a whole new set of things to worry about, and a whole different way of actually getting the need to inspect something. So I think you just watch the news and you see social media, is often the flag for an event, a business, bar, restaurant, etc., depending what's open in your community, is not adhering to social distancing, wearing masks. A lot of that comes to you probably first through social media. So how do you leverage kind of all different channels, the formal complaints, the informal things, and be able to inspect these different entities and do that quickly in a brand new way. So you may or may not have mobile inspection capability in your organization today, where you need to be able to send inspectors out with kind of this electronic checklist, where you are going through, maybe actually doing kind of warnings and letters of compliance and the whole process. It's not, as you know, it's not as simple as going out and say you shouldn't be doing this. There's a whole process to manage. And we have also taken some of the solutions that we've had in market, and actually today kind of released a version of our mobile inspection capability that's really based on trying to handle these new needs with COVID-19. Next slide, which I think might be my last. Yes, it is. So, so there are, I've kind of shared with you the perspective of, how Salesforce is partnering with our private and public sector customers to bring their employees safely back into the office, but also how that same set of technology and products can be used to enable new services, do more things online, to do services that you didn't really have to do or do at scale. And if you're interested in learning more, we've got a couple different websites. And then Michael Berry is a member of my team, and he is your account executive and would be happy to provide you with any additional information. And thank you everyone for your time. Appreciate the opportunity to talk to you today.
Thanks so much, Nancy, and to you, David, before that. We appreciate it. We've got a few questions if you've got a few minutes to stick around and help answer. Nancy, I think the first one's for you, and you might have just touched on it, but if you want to expand on it a bit, we had a question about your technology of who in New York State is using this currently, and how is this priced, or is it priced differently to government clients?
Okay, so the couple different, I'll answer that in pieces. So the Salesforce platform is used by a number of different state agencies and counties to perform different functions. So I'm always careful about what names I can actually say. But I think going with those that have publicly talked about their use of Salesforce, New York City has publicly talked about their use of Salesforce to support contact tracing. Suffolk County has talked about their use of Salesforce to support 311, which is is also being used to handle these services. And then there are several state agencies. So we do have several government customers that are using Salesforce in a variety of means that are directly related to responding to COVID-19. Our solutions are available on a number of different contract vehicles, and we have government discounts and pricing available for the solutions as well.
Thanks, Nancy. And this next question gets, and this will be for David or Nancy, gets to the heart of really a lot of upstate counties, and that's a lot of these solutions need technology and internet-based infrastructure. So with that as background, the question is, in order to deliver teleservices on both ends of the service need, Many need to have electronic capabilities. For seniors, children with special needs, and others, they lack adequate bandwidth in areas or even computers to enable these teleservices. How have you seen any approaches used by government entities to address this issue, both for external services as well as even internal on some of the compliance and safety checks we're trying to do internally with our employees needing better internet capabilities and computers?
David, do you want to take that one first?
Yeah, certainly. So certainly, if we think about, even just the need for, communication, right? Like, changes to services, changes to, in-office hours, et cetera. Good old-fashioned postal service still works for those individuals that are in remote areas or hard to reach or are challenged with bandwidth, accessibility, and what have you. As it relates to workers that might be going out, say for example, child support services or social care workers, they too can still be in a remote area, and whether they are working in an offline mode, which certainly technology platforms like Salesforce have those capabilities to be remote, be out of signal, and then resync, re-upload once you're in there into that coverage zone. Or even just if we think about some of the changes that we need to implement in those offices or in those counties where there is more of a remote or limited bandwidth access. I think even just some of the basic changes to how we think about our offices or how we think about the touch points, the interactions, regardless of whether you use technology or not, there's still a need to adapt to the current situations that we're dealing with, and ensure that we're communicating out effectively what those policies and adjustments look like. So there's a clear understanding of how and what services are provided and continue to be available. Nancy, I don't know if you want to expand upon that at all.
Yeah, absolutely. I think, a lot of the things that you said about being able to do offline access to some of these mobile applications is certainly a key requirement in any area that that has spotty Wi-Fi or cellular coverage. So that's something I think technology platforms of this nature have become very robust in being able to address that requirement. And I would also say in the March-April timeframe, many of our government customers in the Northeast, the first order of business was we have to order a bunch of laptops because most of our employees didn't have a government issued device that they could do their job from and do their job remote, and we had to invest in VPN technology to allow them to access the mission critical systems they need to do their work. And we needed conference calling capabilities that we didn't have. So I think that was a very real need that many government entities, and I can't speak for the person that asked the question, but we saw a lot of folks made some pretty significant what I would call hardware and enabling technologies to support remote work in in the early days of the pandemic. And the reality, I think, moving forward is, those things shouldn't be abandoned. Those are good investments that were made that you should think about. How do you leverage some of those from the employee perspective to enable a more, a different kind of work schedule? It's not 100% back. It's a combination or hybrid schedule because you've invested in those technologies. And then the last point I was going to make on the citizen side, I mean, what we're finding from our industry experts, that many of the citizens that are receiving services, actually access those services through a mobile device rather than a computer. So I would say that the barrier's not been completely eliminated. I absolutely agree, but it is becoming narrower. And I think a lot of, as a technology provider, making sure that you can deliver these digital services on a mobile platform versus an assumption that somebody has a computer, because that's not where the demographic is going. It's having a mobile platform, a mobile device versus a computer.
Thanks, David and Nancy. Got one more question here, and I think David, you mentioned earlier about, especially with the return to work and those in the office, that we've got to take a look at policies and making strong policies to keep people healthy, including even how we're cleaning and to protect against any COVID outbreaks. With counties, we've got a lot of, whether both the public having access, but certainly workforce being there, we've got 24/7 shifts, and one of the easiest examples to think of is sheriff department, right, and the jail. So we've got 3 8-hour shifts coming in. Have you seen anything on this, or any good ideas on with those workspaces where it takes 24/7? How with the uptick in cleaning requirements, what are counties or cities or towns that we've seen to do address those kind of needs?
Yeah, I mean, certainly if you're a smaller county or a smaller city, you're not going to have the budget to necessarily bring in a more robust solution that we're seeing in some of the private sector. Think about some of the manufacturing or the investment trading floors. Some of those private sector clients are looking at autonomous robots that will just roam around and either spray a chemical or blast a surface with a UV light. Those are perhaps a little bit more futuristic, but they're certainly a very interesting new solution to the challenge. I mean, I think at the end of the day, even just upping the basic cleaning crew coverage, so that if we take the example of a sheriff or a jail cell or anything of that nature, where you do have that 24-hour continual shifts, having a regularly scheduled cleaning before the end of the shift as the new crew comes in to take over, certainly that sort of increased focus on making sure that we've got the right cleanliness, surfaces, etc. Even going so far as to ensuring that we have the right amount of hand sanitizer at regular intervals and regular stations, so that we're driving home the notion of ensuring that everyone is mindful of their hygiene and what they're touching, and ensuring that they're keeping as clean and safe as possible. And then the basic continuation of what we've heard in terms of wearing gloves or masks, etc., the PPE, to ensure that we're mitigating against any further spread. And then certainly we can get into, as Nancy mentioned, aspects of just ensuring your own mindfulness about your health and well-being, or looking at things like attestation surveying or contact tracing, to ensure that if there is a flare-up or an outbreak at sheriff's office or what have you, that we're effectively mitigating the further spread by ensuring that we're isolating and quarantining those individuals.
Thanks, David. That's all the questions we have now, and that's going to conclude this webinar. I want to thank David and Nancy once again for this education for our members, and remind everyone that this webinar will be on the NYSAC website. So you can get this at any time if you want to go back, take a look at it, and or distribute this to your other colleagues. They'll also have the contact information for both David and Nancy if you have any questions that you didn't think of now, or want any follow-up with either of them. I'd be happy for your reach out. So thank you again for joining us. Thank you to our speakers, and we will all talk again soon. Thank you.